Hello, Health First Colorado providers. Did you know that Health First Colorado for children under age 21 covers more services and benefits than it does for adults? That's right, and for the youth under your care, it's crucial to be aware of them, because understanding these benefits makes it easier for you to access and advocate for essential health services, ensuring that the young people you treat receive free comprehensive care for all aspects of their health. These benefits are provided through a Health First Colorado benefit called EPSDT. EPSDT stands for Early and Periodic Screening, Diagnostic, and Treatment, and it's already part of Children's Health First Colorado coverage. In this video, we're going to talk about what EPSDT is, what it covers, and how Health First Colorado providers, like yourself, can use it to provide free comprehensive support for kids under your care. We'll also hear from a medical provider who has seen how EPSDT benefits children and youth. Let's get into what EPSDT is and what it covers. E stands for early, assessing and identifying potential health problems early through regular childhood health screenings, assessments, and testing. P stands for periodic, checking youth's health at periodic, age-appropriate intervals, such as those outlined by the Bright Futures periodicity schedule. S focuses on screening, providing physical, mental, developmental, dental, hearing, vision, and other screenings, assessments, or tests to detect potential problems. Now here's the really important part that many people miss. D, diagnostic. That is, performing diagnostic tests to follow up when a risk is identified. This ensures that if you think there's an issue with the child's health, they get additional tests to figure out what's going on. And T, treatment, is about controlling, ameliorating, correcting, or reducing any health problems found. Or to put it another way, EPSDT provides supplemental healthcare services to keep youth healthy, identify other acute healthcare needs, and establish the medical necessity for seeking additional covered care that falls outside of standard Health First Colorado benefits. Here are some examples of supplemental healthcare services that are available through EPSDT. New eyeglasses and dental services as often as medically necessary, new or replacement medical devices, services or items not covered for adults, higher levels of medically necessary care, and much, much more. If it's medically necessary, EPSDT covers it at no cost to the family and without copay. Now let's talk about eligibility. Here's the good news. There are no additional applications or requirements. EPSDT is for all children and youth under age 21 with Health First Colorado eligibility. If the child is covered by Health First Colorado, they already have the EPSDT benefit, even if they also have additional private insurance coverage. Now, even though EPSDT covers a wide range of healthcare services, it's important to understand that not everything is included. The general rule is that if the care directly supports the child's physical or mental health, it will be covered by EPSDT. But some things that aren't directly connected to the child's physical or mental health, like experimental or unproven medical treatments or services for caregivers or providers' convenience, are not covered. Sometimes you will need to seek pre-approval from Health First Colorado before you can provide services. Other times, no pre-approval is required. We cover more about this process, the role of RAISE, and proof of medical necessity in the second training video in this series. Let's go through some examples. Based on what you've just learned, do you think this would be covered by EPSDT? You are tending to a child who needs a replacement wheelchair, though it hasn't been 5 years since they received their current one. Would this be covered by EPSDT? Yes. In fact, wheelchairs are covered as often as medically necessary or as a child grows. Let's try another. You believe that a child could benefit by participating in an experimental treatment, like a procedure or a drug trial for their health condition. What do you think? Are experimental treatments medically necessary and covered by EPSDT? Services that are still in experimental stages and not proven to be effective are not covered by EPSDT. However, proven alternatives would be covered by EPSDT if they are shown to be medically necessary. One last example. A child under your care requires a lung or multi-organ transplant, but this treatment is not available in Colorado. Is this covered by EPSDT? Yes. If the service is not available in Colorado and it's medically necessary, EPSDT could cover it at an out-of-state facility that is enrolled with Medicaid. Now, let's hear from a provider who has helped many patients get the care they need using EPSDT.
I'm Dr. Cassie Littler. I'm a pediatrician at Denver Health at the Webb Pediatric Clinic. I'm thinking about a patient who has cerebral palsy, who I take care of at the complex care clinic here at Denver Health. And I think about all of the complex needs that they have, and not all of those needs are met by the medical insurance that they have. And so the EPSDT benefit really helps to cover those extra needs that the child and the family has. Things like medical equipment, additional services, resources, and connection to care, which is really important. My role in getting the care that a patient needs and that I recommend for them is as an advocate for the child and for the family. Our team works hard to coordinate care and get those needs and services for the patient and their family. Sometimes it can be a small challenge to get patients what they need. Many times we have to write a letter of medical necessity, which just takes a small amount of time out of our day when we know it's such a big benefit for children and their families to get the resources that they need. It's really important for medical providers to know about the EPSDT benefit because it really can change the life of the child and the families that you're working with. I would advise my colleagues and medical professionals that if there's a service that a child needs that's medically necessary, just ask for it because EPSDT will probably cover it.
The experience of this provider highlights the positive outcomes EPSDT can bring to the children in your care. We know a child's well-being is your top priority, and EPSDT is a critical benefit that can help you ensure that a child in your care gets their health needs fully covered without costs or copays. Check out our Part 2 of this training to see how to make a request for EPSDT benefits and find other resources at hcpf.colorado.gov.